Welcome to the session on support and delivery of psychomotor skills in online and virtual environments. My name is John Lee Anderley, and I will be your guide over the next few days. We will begin this introductory video by discussing a prominent education psychologist, Benjamin Bloom. Mr. Bloom is renowned for his development of the mastery learning theory and also for his seminal 1956 textbook, Taxonomy of Educational Objectives. In this textbook, Bloom identified the three domains of learning. Bloom identified these as the cognitive, affective, and psychomotor domains. Cognitive refers to the knowledge involved in learning. Affective involves the attitudes and beliefs involved in learning. And psychomotor relates to the actual skills involved in learning. When we look at these three domains and the concept of carpentry, we can talk about the knowledge that's important, as it is important to understand which is the nail and which is the hammer. It's also important to know which end of the nail you hit with which end of the hammer. When it comes to the affective domain, I think we have all seen the results of good carpentry and bad carpentry. In some cases, this is a result of poor attitude toward doing good work, and in other cases, it's poor skills. When we discuss these skills, we are talking about the psychomotor skills, and anyone who has hit their thumb with a hammer has experienced the negative outcomes of poorly developed psychomotor skills in the area of carpentry. Often when we think about psychomotor skills, we think about sports. Certainly, psychomotor skills are important in the performance when you are playing basketball or football or baseball. But psychomotor skills are also extremely important when we talk about the area of healthcare. Anyone who has been certified on CPR or cardiopulmonary resuscitation has developed at least a baseline level of psychomotor skills in the performance of these procedures. Some people have actually taken CPR training online. ProFirstAid.com is an example of one online delivery platform that is approved by the American Red Cross in the delivery of psychomotor skills. More recent areas of the delivery of psychomotor skills in an online environment involve training to use the automatic emergency defibrillator devices, or AEDs. There are several sources of training online on how to use these life-saving devices. In other cases, we have seen the use of virtual environments to develop psychomotor skills. Many nursing schools have developed virtual simulation labs that involve reactive patients. These labs can be used in a simulated virtual environment to enhance the psychomotor skills involved with many common medical procedures. In another area that has received little interest in research, psychomotor skills have been delivered online in the area of law enforcement detection and apprehension of impaired drivers. This training is relatively new and is potentially an area where I will be conducting some of my dissertation research. Other virtual environments involving psychomotor skills include driving simulation labs and flight simulators. Here we see a picture of a full motion Redbird flight simulator. The controls are set up very similar to what a pilot would find in a real airplane. However, the simulator can be set up to simulate emergency procedures and allow the pilot to practice these emergency procedures without fear of injury. As you can see from the exterior of this Redbird simulator, the simulator is set up to respond with physical responses to the flight controls used within the airplane. This provides for an extremely accurate virtual reality experience. This concludes the introduction into this section. You will also find a Prezi that will explain the steps involved in psychomotor learning, and you will also find a PowerPoint in this section that give you a brief overview of what some of the research in this area has so far found. Please take a look at these other items and join me in the discussions this week.